You are listening to Specifically for Seniors, a podcast designed for a vibrant and diverse senior community. I'm your host, Dr. Larry Barsh. Join me and a lineup of experts as we discuss a wide variety of topics that will empower, inform, entertain, and inspire as we celebrate the richness and wisdom of this incredible stage of life. A fact check at the Whitehouse website proclaims, quote, President Trump will always protect Social Security and Medicare, close quote. It goes on to quote Elon Musk saying, the waste and fraud in entitlement spending, which is most of the federal spending is entitlements, so that's like the big one to eliminate. That's the sort of $500 billion, maybe 600 to 700 billion a year. After a list of facts about fraud, improper payments to deceased individuals, and improper payments to both Social Security, Medicare, and Medicaid services, the page goes on to ask, quote, what kind of a person doesn't support eliminating waste, fraud, and abuse in government spending that ultimately costs taxpayers more? I'll include a link to this page in the show notes below. Am I missing something? First, Social Security and Medicare are not entitlements. They are services for which older Americans have paid for by deductions from their salaries. And second, where is in this so-called fact sheet plans for how President Trump is going to preserve Social Security and Medicare, except for a statement that reads, the Trump administration will not cut Social Security, Medicare, or Medicaid benefits. President Trump himself has said it over and over and over again. Conversely, President Trump's budget seeks to reduce or eliminate the Older Americans Act, to dissolve the Administration for Community Living, and cut funding to critical services that help older adults to live independently. In order to be able to understand more completely what's going on, we called on Nathan Boucher to explain the effect of Trump's real budget proposals on senior care. Nathan is Associate Research Professor in the Sanford School of Public Policy and Duke University's faculty at Sanford School of Public Policy, the Medical School, and the Nursing School. He is also a Senior Fellow at Duke Center for Study of Aging and Human Development, as well as Duke-Margolis Center for Health Policy Core Faculty. Welcome to Specifically for Seniors, Nathan.
Thank you. Thank you, Larry. I appreciate you inviting me.
Let's start off by defining the purpose of the Older Americans Act and the Administration for Community Living.
Sure. Just to kind of keep it succinctly, because these are big, complex organizations, but the Older Americans Act came about in 1965, right around the same time as Medicare and Medicaid, as it turns out. And that is a bevy of services that it provides for. It's looking at transportation for seniors, programs like Meals on Wheels, legal assistance, elder abuse prevention, health promotion efforts when it comes to specifically, and most importantly, I think, low income, possibly isolated, often at risk older adults who really depend on community-based services to maintain independence in their communities. And then the Administration for Community Living, that came about much later, about 2012, under the Department of Health and Human Services, and that oversees the Older Americans Act programs. And their mission is to maximize, again, independence, well-being, the health of older adults and people living with disabilities, as well as their families and their caregivers that support them in the community. That caregiving piece is so vital. So supporting them is really important. So these are all very consolidated federal efforts. Up until recently, largely under one or two roofs, if you will, to try to keep it organized, to keep that whole communication and referral process organized. And there's now demonstration by the current administration that they want to really parse it out and stick it into different places. And I really think that can be a detriment and will only serve to hobble the great services that we have available to older adults in America.
Are they under one of the cabinet's departments?
Yes, Department of Health and Human Services, but it's being proposed that they want to divvy up the OAA, or the Older Americans Act, pieces to different departments. And I think by doing that, what two things would happen. I think it would denigrate what's available, and it would, like I said, further hobble communication and referral processes.
So it'll have a direct effect on the critical services for older adults.
That is what I and many other experts in this field believe. Yes.
Isn't that an assault on older Americans directly?
I think so. Everybody worked very hard in their lives, and now are older and hope to get those services from Medicare and Medicaid and the Older Americans Act. And I do believe that this is an assault on those services and supports. Understand, it's not just money flow; it's supportive services, it is communication, it is health promotion, and it is also additional supports for the families that do all that work out in the community for older adults living at home. We're trying to keep people out of facilities, right? Facility care is very, it can be helpful when needed, but it is not the place to be if you don't truly need it. It's very high cost. So if folks can remain at home and their families can be supported to support them, that's a really key part of the bevy of services that the OAA and the ACL provides.
The older adult services are particularly interesting for the listeners to this podcast, but it affects younger adults with disabilities as well.
Absolutely, and understand that our conversation here about the denigration of the Older Americans Act and the ACL is happening in tandem with the proposal that Medicaid should be cut. That is being proposed right now, and is receiving initial support and votes at the House level. And we need to see what happens. But these go hand in hand. Medicaid funding is part and parcel to the support for older adults and people living with disabilities out in our communities in America today. It is a myth that Medicare provides services for older adults, long-term care specifically. It is Medicaid. It's either cash money from people's pocketbooks, or it is Medicaid that largely provides our long-term services and supports and home and community-based services. So we are looking at both the denigration of these offices for the Older Americans Act and the ACL, but also an overlay of major funding cuts for Medicaid that actually back up all of the components in the Older Americans Act.
And it's not just for services, it's elimination of some of the research that goes along with it.
Absolutely. There is now there's a lot of research through NIH and the Veterans Administration and other conduits, but there is hand in hand research that goes with the funding for the Older Americans Act, and that is true. If it's not, what the administration is doing is not just degrading services and research, but also the drive to want to make programs better. Right, the pro learning, pro research to try to improve services and improve quality for older Americans in our nation. And so So it's not just the practical dismantling, but also an ethos that is now invading America today.
Yeah, and that seems to be going along with all research, medical research in general.
It is true. Yeah, I don't want to talk too much about my own jobs per se, but there are certain areas that the research is still being supported, but there are other areas where research is at risk for sure, and all institutions are bracing themselves for potential major changes in research funding.
So, what in the administration's stance makes this cutting of funds necessary?
I think there's calls for efficiency, which every new administration does. They may not give it a funny name for their effort, but every administration does that. As you go back and look historically, this is not a new idea. Waste, fraud, and abuse exists at every level of private and government organizations. They have yet to truly find waste, fraud, and abuse. It seems, but sure, I am all for keep things efficient. Let's avoid duplication. Let's use taxpayer dollars wisely. I am all on board with that. But this is an assault, as you say, a very drastic chain of events that is not taking into consideration the things that really do work well in the U.S. government for older adults.
So, President Trump has claimed that Social Security, Medicare, Medicaid will not be touched. And he has, the website has said, repeated this over and over and over again. But in light of the proposals in the, uh, I hate to even say it, big, beautiful bill, um, is there any reassurance that senior citizens will continue to get care?
Uh, I think services will continue on some level, but if you cut Medicaid dollars, they will be greatly curtailed. Understand that we have 50 different state legislators and governors all needing to balance their budget. They can't just raise their deficit like the federal administration and legislation can. So each state relies on these Medicaid dollars. And if that is not flowing in to states, whether you're red, green, purple, or blue of a state, you're not going to be able to get those Medicaid dollars, and somebody will have to pay. People will either stave off care till they get sicker, and then they still show up at the ER, and then health systems and taxpayers still have to foot the bill. So if you're getting rid of the mechanism for payment to have people enrolled and well covered in Medicaid, then we still have to pay for that care, and people are going to get sicker and wait till they're much sicker and have to spend a lot more healthcare dollars once they do arrive at the emergency department.
So there are two major proposals for the changes in Medicaid that have been recently proposed. And these are being imposed on people who are already potentially very sick. There's a work requirement and a community service requirement.
Mm-hmm. Mm-hmm. Now, again, Medicaid is means tested, but this additional work requirement being quite rigid with that, which will probably to some degree each state will be able to interpret that as they have to date, what those requirements might be, or how much recipients might get held to those requirements. It's not going to be possible for some people to meet those work requirements. Understand that it's in this economy or any economy, it's hard to to make ends meet for many individuals. Many have dependents, many have to work several jobs, and even then still don't have enough money to pay for health insurance. So Medicaid is so critical to individuals, and as you know, and your listeners know, of course, if you are able to work, then you are potentially able to get employer-sponsored insurance, which is how most Americans, even after the Affordable Care Act, most Americans still get employer-sponsored insurance. But if you're unable to work because of physical or other mental illness, and you're also, caring for mom or dad as well as caring for younger children, and sandwiched in that regard, if you will. Yeah, it's very difficult to balance all these things, and Medicaid really fills those gaps and is so critical to individuals, even the working poor.
You mentioned that states can't have to stick within their budget, and without the federal funding, are states going to be able to provide even basic services for Medicaid?
I can't imagine they will be able to do it at the very same level. Understand there's already a state to state variation, right? Politics plays a key role in how beneficial a state Medicaid program is, what menu of services are available to citizens in that state. It may vary. If you're in Massachusetts, it might be fairly provide quite a few things. If you're in a state that maybe is not as politically, we'll say, liberal, or as Democrat, you sometimes find a trend that the state Medicaid program in a state like that is maybe not quite as rich a series of services that are afforded. So I think I don't see, with the cuts and with dismantling of the Older Americans Act, I don't see there being a maintenance of what we have even now, and there could be actually very harmful reductions in services that are allowed. What is basic service is open to a lot of interpretation. We don't do preventative care very well in the United States. We do trauma care very well. We do emergency care very well, but we don't do a lot of good preventative care and have our eye on the ball, 10 years down the road for an individual as they age or maybe get sicker. So we don't do a lot of prior planning and preventing disease, and Medicaid cuts and dismantling of the Older Americans Act will just further add to that those reductions.
It would seem, from what you just said, that this is going to adversely affect red states, poorer states, more than it's going to bother the recipients of Medicare in wealthier, to use
Medicaid, yes. Just so that we're clear, yeah. So this is affecting reductions in Medicaid, and so yes, I it's hard to say that off the cuff, but that has been the trend in the past. Is that politically more conservative states tend to have not as robust Medicaid offerings. Each state does have a Medicaid program, but they can also choose in part what to do with those dollars that come from the federal government, which they then match at the state level. So they have a lot of latitude in doing that. But if they're getting less money, I think it's just plumbing, right? If you're getting less flow and support from the U.S. government, then there's going to be less matching at the state level, and that will result in less services to give to current enrollees or even to add new enrollees at the state level.
Where is this politically advantageous for the Republicans?
It's politically advantageous, and not to get too much into politics because that's not really my area. But I would say this results in useful talking points for people trying to get reelected among their various bases. However, it's just not good administration at the state level. It's not good budgeting at the state level, and you're still going to have to pay for it. So, if people seek care in your state and there's less Medicaid dollars or less people on Medicaid, that care will still have to be paid for somehow, and that ends up coming out of potentially local taxes, potentially healthcare systems get inundated, potentially local smaller, especially rural hospitals may have to close because they're not generating the revenue that they need to generate to maintain operations. And we, even under the current circumstances, we see rural hospitals closing here in North Carolina and across rural areas of America. So if you think that's going to get better with Medicaid cuts, it just won't. I don't see how it can.
In addition to the work requirement, there's also a statement that people would have to verify their eligibility for Medicaid twice a year rather than just once. Aren't the Republicans just using paperwork to throw people off Medicaid?
On the face of it, that's what it sounds like to me. Again, I'm not a politician or delve too much into politics, but it just on the face of it, the practicality is if there's more burden on the part of care recipients and Medicaid recipients, that will serve to be yet another hoop to jump through in order to maintain your Medicaid coverage or to initially get on Medicaid coverage, and those can pose as barriers. We all know as family caregivers and aging Americans ourselves that that N+1 task that we need to do that day can be enough of a barrier that it keeps us from doing stuff, and sometimes in our own best interest, because we're already overburdened with our own care or caring for others, and I think throwing up those extra barriers does not serve Americans' health.
How many people are these changes to health insurance, both Medicaid and the Affordable Care Act changes that are somehow thrown into this? How many people is this going to affect?
I mean, I don't know the exact numbers, but it's millions. I think Medicaid is on the order of older adults and people with living disabilities could be more than 6 million individuals that this is going to affect directly. And I just and I think it's hard to even guess because if Medicaid continued in its current state, there's potentially new enrollees that could be funded under that. So I think we're looking at reductions in future enrollees and also reductions in services available to current enrollees. And I don't know the exact numbers on that, but we're talking many millions of individuals in the U.S.
And these changes were originally proposed to be enacted sometime in 2029, but they were pushed up till, surprisingly enough, right after the midterm elections.
Right. Yes. I mean, I think I would do the same thing if I were playing politics, right? You want to make sure that you made these drastic moves that are going to hurt a lot of people and possibly benefit some other people. You'd want to time that correctly for yourself and for your own election runs.
So, what can we in the public do about this? How do we change it?
Well, I mean, I know sometimes people, write your congressperson. People feel like that's a, not a good move. But I think in the various localities, if Congress people in their districts are hearing, um, calls for change, calls to not cut services and supports for older Americans and those living with disabilities, I think that does make a difference. And so that is part of advocacy and educating both our policy leaders, lawmakers, but also our local communities. Um, I think mobilizing the various constituencies is important. We have the area agencies on aging, senior centers, other advocacy groups that can be engaged with letter writing campaigns, town halls with policymakers and elected leaders, testimonies at hearings. A key piece of this, as you already brought up, is trying our best to protect research collaborations across various social and healthcare systems. Understand that major impacts on health outcomes also have social components, right? We talk about social determinants or influences on health, and that could be housing, transportation, caregiving support. Those, when they're in place, serve to keep older Americans and those living with disabilities at home, independent as possible in their communities. I think, again, whatever we can do to inform the public and communicating that these risks of funding cuts to the general public and caregivers is going to affect us all, regardless of what sort of political stripes we might wear. This is going to be a red and a blue state issue. This is going to be a rural issue for sure. And people in rural areas are across all political spectra. I feel like this is going to affect us all. If a state cannot have the money to protect and pay for Medicaid services for their poor, everybody in that state is going to feel it on some level.
Do you have anything to share that would make a lot of us who are older feel better, feel more positive about what the future is going to bring?
Well, there are two things going on here. I think the potential Medicaid cuts overtook our conversation a bit because that is, very much in the zeitgeist right now. That is a major issue on the table. And we have to kind of wait and see on that and see if there are lawmakers who, regardless of their political background, may say, hey, our state really does need these Medicaid dollars. No, I'm not for this. And we have to see what happens. However, it is a Republican-controlled Congress, and we have to see where that goes. The other issue is the Older Americans Act and the Administration for Community Living. Those are administrative shuffles. It could be that that's temporary. When a new president gets in the door, they could maybe correct some of that situation and solidify once again what the services and supports that come under the Older Americans Act and the Administration for Community Living, what that looks like under the next presidency. And then, after these 4 years, I know that's cold comfort because it's still 4 years of reshuffling potentially going on here for the Older Americans Act. But I think some of that could be temporary and corrected from an administrative point of view. The Medicaid cutting is another story because those are, if it passes, those are changes that are due to come into effect past the current presidential administration, years past the current presidential administration. So that would be more baked in for sure. But where there's a will, there's a way with policymakers, and some of it that could even be corrected down the road. I think we have so many awesome community-based services out there, senior centers, area agencies on aging. Some of that funding is not federal and state. Some of it's private foundation funding and charitable giving and so forth. And those people who work in those organizations are mission driven. And will continue to do their best to provide what they can to older adults and people living with disabilities in our communities. So I think it's a hit to morale and not just funding, but you have so many dedicated folks that I work with on a daily basis here in North Carolina, so many dedicated people working in the aging services community and the community serving those with disabilities. So I think that mission, that passion will continue. So I like to think that won't solve it, but it'll maintain a lot of what we have, I think.
Do you think there are going to be any staff cuts necessitated by these programs?
It may very well be so, because if there's not money flowing in, it's hard to maintain operations. Certainly at county level and state funded offices, if they're receiving Medicaid dollars that then get cut. Nonprofit organizations, some of that impact will trickle down to nonprofit organizations doing so much of that work in the community for older adults and people living with disabilities. So we'll have to see. What that ends up looking like. It's a bit of a wait and see game on the Medicaid cut question.
Do you see any changes coming for the Affordable Care Act?
The opponents of the Affordable Care Act for years have said, get rid of it, but nobody ever has had a viable replacement option for that. And so now you've had hospitals and healthcare systems and business processes all baking in what the Affordable Care Act does for Americans and what it serves to do. I think having a sweeping change, such as getting rid of the Affordable Care Act, would be largely unpopular with health systems and businesses. And so Americans like the Affordable Care Act. It is actually pretty popular among Americans, and so I don't see that going away. Now, there have been over the years Supreme Court challenges that have sought to hobble the Affordable Care Act, one of which was getting rid of the individual mandate or the requirement that you either had to be on insurance or receive a tax penalty at the end of the year, and they got rid of that individual mandate. That helped bolster the pool of individuals that were being covered under the Affordable Care Act. So right now, the individual mandate hasn't been around now for several years, but the Affordable Care Act has continued, I hope that remains in place. I don't see that going away, but again, that's not the majority of Americans get their insurance through employer-sponsored insurance and Medicare and Medicaid. So the Affordable Care Act is important to many millions of Americans, but it's just a piece of the puzzle.
It's been great talking with you. And now I see why a large proportion of your students gave you a favorable rating.
Oh, are you looking at the ratings, huh?
Hey, I wanted to know who I was going to be talking to. But it's an important discussion, and I hope that we've given some hope to the people who are going to be on, might be on Medicaid. A great discussion. Thanks, Nathan.
Thank you, Larry. I really appreciate your time today.
Thanks a lot.
If you found this podcast interesting, fun, or helpful, tell your friends and family, and click on the follow or subscribe button. We'll let you know when new episodes are available. You've been listening to Specifically for Seniors. We'll talk more next time. Stay connected.